many lectures that we have at the IFS. They're all available on demand. And then some of them we're doing live replays with the speaker so we can interact with the speaker and have Q&A. Today's topic is the 5 keys successfully establishing a partnership with a reproductive endocrinologist or an infertility subspecialist. And our speaker is Dr. Laurena White. This is really the best person I can think of to offer this lecture because Dr. Laurena White is an MD, is an OBGYN, she's an IVF specialist, and she is also a qualified, trained, licensed acupuncturist and Chinese herbalist. So she has done both paradigms. She's trained in both, and she's the author of Natural Pregnancy Guide. She even has a lovely book out. So she's taken some time to put her thoughts onto paper as well. And so integration, this is what the public wants. And it's difficult if the left and the right hand don't know what they're doing, or if the left and the right hand don't want to work together. And so Dr. Laurena White today is going to talk about how to develop this relationship and how to create this integrative model. So I'm very excited for that. If you're watching this on social media and you have already registered for the IFS, please jump off of social media and get to the IFS website. You can get to through Healthy Seminars if you don't have the IFS website memorized. And then find the link. The link is under the live events under the forums. So go to the forums, look for live events for May 1st, and you can get the Zoom link. So come on in because you'll get to watch the whole thing together. We're only do a little bit of the lecture for those on social media. And if you have not registered, but you're interested in being part of the IFS, then again, go to the Integrated Fertility Symposium website. You can get to it through healthyseminars.com. And from there, you can register. Registration closes May 9th. So I just want to show those that are part of the IFS. When you go into the lectures, you're looking for the handouts. This lets you know what everything is approved for. There's a little description, learning objectives, and then you just get started. And so you can download your handouts. The video will be up on demand immediately after this live replay. And remember, after this lecture, to get your certificate, you do need to do the worksheet. The quiz has 10 multiple choice questions, pass the 70% in the course evaluation. Then the certificate will get emailed to you and also go into your dashboard, your account. So remember, if you're part of the IFS, watching the course is part of it, but you do need to complete the assessment tool in the course evaluation for your certificate to go into your account. All right, as I mentioned, our speaker is, I'm going to stop my share. Team, please bring up the video. I do want to remind you before I bring up mentioning our speaker one more time, this is for educational purposes only. This is not meant to be medical advice. It's not intended to be medical advice. So do not perceive this as medical advice. If you have a health condition, please seek out a healthcare provider. This is for educational purposes only. Thank you. We have 2 amazing lectures from Dr. Laurena White. The one about using integrative approach in Chinese herbal medicine, acupuncture on treating fibroids is available on demand. Today's lecture is about establishing that relationship, that partnership with an IVF clinic or subspecialist to really have that integrative care. We've also have added to the public educational video section on IFS, only available to those that are part of the Integrated Fertility Symposium, a 15-minute interview where I talked to Dr. Laurena White, and she educates the public on integration, on how it can support you with fibroids and also going through fertility or even IVF. And she talks about how she uses acupuncture and herbs leading up to and during an IVF process. And this is special because she's an MD, OBGYN, IVF specialist, and she's trained in Chinese medicine. So if you're looking at fibroids, she's doing the scan so she can see whether they're shrinking or growing. She's doing the IVF and stimulation and checking those embryos and those eggs out. So she's got that clinical experience that us as naturopathic physicians or Chinese medicine doctors don't get, but she gets to see both and see how both paradigms together benefit the patient. So without further ado, I give you what I call Dr. 3.0, Dr. Laurena White. Stick around, post your questions in the Zoom chat because Laurena's here and she's going to take your questions and we can have a discussion about this topic after this lecture, and then we'll carry it over into the forums on the IFS website. Take it away.
Today, we're going to be talking about the 5 keys. And these keys are built on my own personal experience as I made a transition to working in the field with reproductive endocrinologists and as an OB-GYN, but as I moved to an integrative health and wellness practitioner, and especially focused in women's health, I expected the transition to be pretty easy, but even for me, it was a little challenging, make that a lot challenging, excuse me, and just going through the trials and errors of just growing a practice and truly establishing successful partnerships was a task. And so a lot of people ask me how I did it and what worked and what didn't work. And so this is just a little culmination and hopefully some tips that I used along the way, and hopefully they'll be useful for you as well. So the first aspect is just some introduction to the players. So who are all the players that are going to be on a health and wellness team, a women's health and wellness team, especially when she is experiencing fertility challenges or when a couple is? So the first thing is usually a reproductive endocrinologist. And a lot of times we use reproductive endocrinology and infertility synonymously. However, they're completely different. So I wanted to take some time right now to distinguish the difference between a reproductive endocrinologist and an infertility specialist. So a reproductive endocrinologist is a subspecialty of OB-GYN, and they're a board certified physician. Go through a selective and competitive process when they go through their subspecialty selection, and they receive special training outside of obstetrics and gynecology. Infertility specialist, on the other hand, is an overall generic reference to a person who can make claims that they work in the field of fertility. So that can be anyone from a bona fide reproductive endocrinologist all the way through to someone on Instagram who has had their own infertility challenges, and now they claim that they're an expert and they're working with women who are experiencing fertility challenges. And the distinguishing factors are there's no schooling required, there's no special testing required, no certifications, no monitoring, no oversight. And so there is a wide field of those who have a special interest in and potentially special experience, but it has not been ratified or sanctioned by an organization or government. And now that we're talking about integrative health and wellness, the acupuncturist, a Chinese herbal medicine provider, and potentially other integrative health providers like massage therapists, nutritionists, dietitians, vaginal steam facilitators, and any other practitioners who may or may not be involved in the health and wellness care team. I often refer to the 5 pillars, the treatment pillars in TCM, when we think about Chinese herbal medicine and nutrition, acupuncture and moxa, feng shui, which is my personal favorite. I'm a little bit of a feng shui nerd. Movement in terms of energetic and physical movement, and also meditation. So the first key is acknowledging the challenge. If you attempt to create this partnership without acknowledging that there's going to be a challenge, then you're already putting yourself behind the 8 ball, because it isn't as simple as making a referral, because there are 2 different treatment modalities, 2 different industries, 2 different approaches to health and wellness. And so there is a challenge because there's terminology differences, there's conceptual differences. The approach itself is generally different. And we'll elaborate a little bit on that later on. But the first thing is to just acknowledge the challenge. So patience is going to become a virtue. Patience is the ability to count down before you blast off. So a lot of times we want to start and end at the same time, meaning we have a plan, we want to get to our goals, we want to get there, start seeing patients and go, but we haven't necessarily laid the groundwork. And I find that was a challenge for me because I felt I had everything already together. I had already made the connections. People knew who I was. I had already the skills and the abilities, and it was still a challenge for me to make those connections and to work within 2 different modalities and industries, both of which I belonged, but at the same time had not had a lot of integrated conversations together. So good things just take time. Working together is going to be great once you get to that point. However, it's going to take time. And during this time is a great time to assess your own personal readiness and your mental strength. Are you ready to take on patients in an integrative way? Are you ready to be able to have discussions in terms of using accurate terminology? Are you well-versed in the ability to communicate with a reproductive endocrinologist? And those topics we'll talk about a little later on, but assessing your readiness, your personal readiness, will be important. And patience is that companion of wisdom. And a lot of times get extra time so that we can gain more knowledge. And then with that wisdom and knowledge, we'll be ready to apply it, and you'll be ready for the patients that come through your door. And just like patience is a virtue, mutual respect is as well. And when we talk about respect, keep in mind that while we have, as acupuncturists and as Chinese herbal medicine practitioners, we have our process, but that's a whole complete process that's different from a reproductive endocrinologist and OB-GYN, because it's not familiar. It's not the training that they received. It's not the training that we received. And I'm saying we and they because I do dance in both worlds. And so the training is completely different. The approach is completely different. And so consequently, our respective processes are different as well. So the right time, the right principles, and the right way. So during this time, just keep cultivating your craft, whatever that is, however you approach care, and keep honing your craft so that when the time does arrive, you'll be able to approach it the right way with the right treatment principles and be ready at the right time, and doing all that with a good attitude. So let's talk about turf wars. So there's always this dichotomy between Western versus Eastern, and acupuncture versus ART, and traditional versus conventional, and ART versus Chinese herbal medicine, and TCM versus 5-element. And none of it's productive. Absolutely none of it. All of these things exist because they do serve a purpose. And depending on the patient, depending on the condition, depending on a series of different types of factors, every single one of these modalities is going to serve because they have proven to serve, because so many patients and people have gone through and experienced success with all of these modalities. So creating these turf wars in terms of my patient, your patient, you did this, I did this, we do it this way, you do it that way, is not helping anyone. And at the center of this contention is a patient that wants either to get better, wants to get pregnant, wants to conceive, wants to have a baby, and wants to start a family. And the behind the scenes tug of war and just overall turf wars about protection and keeping this patients as property is not beneficial to anyone involved. It's not beneficial to the partnership. And it's also not beneficial to the patient that's at the center of it all. So just keep in mind that the infighting and the together fighting and the turf warring is just a non-productive aspect to benefiting the team, because in essence, we're better together. And you're going to see that this is going to be a theme that kind of resurfaces throughout this talk, that there's always going to be something that the other does better or does more effectively or does more efficiently. But the key word is synergy, and that when we're working together, we're working for the best outcomes of the patient. So let's talk about